Simple interrupted stitches are often used to sew up lacerations, like you might see in the emergency room. First, just grasp your needle at about 90 degrees. Pick up the skin with your adsense or power pads, and then you want to go in at about 90 degrees, and you can go in 2 bites, or if you want, you can just take both skin edges in 1 bite right here. Push your needle through so that you're not grabbing the tip of the needle, which would dull it, and then you can pull your string through. I like to hold the needle with my needle drivers near the tail of the string, and then with my other hand I'll pull the tail of the string short. That way I can see both the needle and the tail of the string. The key to doing a good instrument tie is that you want to lay down your needle drivers parallel to the incision. And then if I'm going to start off doing a surgeon's knot, you want to make sure that you always go over as well. So I'll go over once, twice for my surgeon's knot, and then I'll grab the tail here, and I'm going to pull it from the right side of the incision to the left side. And that allows me to put a little tension because I did the surgeon's throw there. Now I'll put the three important things for this to do a square instrument tie is needle drivers parallel to the incision, go over it with the suture string. Then when you pick up the tail, bring the tail to the other side. Now it's on the left side. I'm going to bring it to the right side of the incision. And you can see it's a nice square knot. Those first 2 throws complete my first knot, which is a surgeon's knot, and every throw after that is going to be another knot. Since this is nylon, I want to do 6 knots total. If it were Vicryl, I would do 4 knots. So 6 knots is going to be 7 throws. Third throw, second knot. Third knot, fourth knot, fifth knot, sixth knot. And then I would just cut this about ½ centimeter long. One of the things you want to watch out that you want to avoid is you want to avoid grabbing the tail too close or in the middle, because when you do that, it's going to be tough to pull it through. As you can see here, I grabbed it too close and now I've got this little tail that's not coming through. So when that happens, you stick your needle drivers through the loop here and then just pull the rest of the tail through. Then when you're done with your knots, you want to pull it tight to get those last 2 knots tight so they won't come off. And then basically you just cut it off about ½ centimeter. That's all there is to it. Now I'm going to show you one at a little bit faster speed, okay? Because they actually can be pretty quick. So we'll go right here below it, take our stitch, pull it through, and we go surgeon's knot, 1, 2, 3, 4, 5, 6, and cut. After you put these sutures in, it looks a little nicer if you try and pull them all to one side. It also makes them easier to cut when you're removing them.